Thank you for joining us today. I think we're going to have a really good time. We're going to have a conversation with Melanie Cumbee, who is one of the nation's leading experts in well-being, individual well-being, and organizational well-being. In 2019, she was recognized by the WellCoa organization as the nation's top well-being expert. I watched her design and implement a well-being program for a $3.5 billion organization that had astounding results. 93% of the employees said that they changed their health habits because of the organization's commitment to well-being. 67% said that they were more engaged in their work, and sick days went down by 40% with a corresponding reduction in the cost of providing healthcare benefits to employees. So we're going to talk to a woman today who is committed and passionate and knowledgeable and is going to teach us all a great deal about individual and organizational well-being and the connection to leadership and the opportunity and privilege we have as leaders to impact people and their health. Melanie, given your expertise and your passion for well-being, how do you feel about starting a conversation off where we talk about that connection between leadership and well-being? And my first question for you is, how do you define well-being?
Well, thanks, Tammy. It's great to be having this conversation with you. So I would say I define well-being through the research of Gallup. So Gallup has done research for over 50 years across cultures and countries across the globe, and they've identified 5 key elements or drivers of well-being: purpose and career, social well-being, community well-being, financial well-being, and physical well-being. And when someone is thriving in every single one of those elements, they have an experience of well-being. Well-being is really an epiphenomenon.
So what can employers do then? Is it their responsibility to address all of those 5 factors?
Well, I think if we're landing the plane, the responsibility of employers is to, number one, prioritize it and lead it as a strategic initiative. And it really is for their teams providing the right tools at the right time in the right environment.
I remember you telling me one time that it isn't up to the leader to convince the employee what they need to do, but it's the leader's responsibility to create an environment where employees can make better choices. And that really stuck with me. What else can leaders do? What's the most important responsibility a leader has?
The most important responsibility is being an inspired adopter. That's a phrase that we use in my current organization. So how can you, as a leader, embrace your own well-being journey? How can you walk that out visibly with your teams? Because that's really one of the key elements of creating a culture of well-being, is seeing the role modeling and the way that your leaders prioritize their well-being.
What are some of the most compelling and creative things you've seen leaders do to walk that talk?
Well, I think there's a great opportunity, even just on a regular check-in, right? So, all leaders should be connecting with their teams on a regular basis. And one of the best things that you can do is say, hey, I'm working on this, on my well-being. What are you willing to share what you're working on, and how can I support you? And I think a good reminder is that we might hear a variety of things from those 5 elements. Someone might want support with their physical well-being. Maybe they just want to know that you're going to have someone cover them during their break so they can go outside and walk the building for 15 minutes. Or they might just want some accountability around financial well-being. Hey, would you remind me to check on our 401k program that we have in the organization? So that's one of the most powerful things that we can do, is have those conversations that demonstrate that, where we share, there's some vulnerability in that, where we share our own well-being priorities and ask how we can support our team members.
So one of the things that you have the privilege of doing now in the work that you're doing, you are launching a partnership between the Adventist Health System and the Blue Zones at all 24 of their hospitals for their 24,000 associates, just a little job. Could you tell us a little bit about the Blue Zones and what is it?
Absolutely. So I have the amazing opportunity to be part of this initiative to bring Blue Zones to our Adventist Health Footprint campuses. So Blue Zones, if you haven't heard of Blue Zones started with some research by Dan Buettner, a National Geographic Fellow over a decade ago. And he was tasked with this massive undertaking to find the areas in the world where there are the most people that are living well, living long and living well. So he discovered 5 Blue Zones across the world where they're the greatest concentration of centenarians, those people living over 100. And out of that research, he discovered there were 9 key principles, or in Blue Zones language, we call that the Power 9. So there are the 9 common threads in every single one of those communities around the world. And so what we, when we talk about Blue Zones and we talk about kind of creating a framework for employee well-being, it's really how do we implement those Power 9 practices personally and professionally. And again, it's all about environment. Blue Zones is very driven by environment and social connection, because we know those are just as important for health and overall well-being as running a marathon or eating broccoli.
Eating broccoli. So if someone who's watching today is interested in learning more about the Blue Zones, how would they go about doing that?
You can take advantage of listening to a great TED Talk by Dan Buettner. So if you just Google Dan Buettner, Blue Zones, you'll turn that up. Dan Buettner also has several books on Blue Zones. So Blue Zones Around the World, Great Blue Zone Cookbook. And he also did some additional research around happiness. And so those are some of my favorites, but I would start with the TED Talk. It'll give you a great overview and understanding of Blue Zones around the world.
So the Blue Zones, I want to live to be 100 years old, Melanie. So do I have to move somewhere to do that?
So you don't, but you can apply some principles, actually, Tammy, that we learned in the Blue Zones. But there are 5 original Blue Zones that were part of the National Geographic research and Dan Buettner's research that he did over a decade ago. So Dan was tasked with searching the world to find the areas in the world where people didn't only have a long lifespan, they had a long health span. And so he discovered 5 different areas in the world, one in Japan, one in Greece, one in Italy, one in Costa Rica, and one of, in all places in America, in Loma Linda, California, which is a Seventh-day Adventist community.
Well, they picked the right person for the job. They're very fortunate to have you. I know it's going to be an amazing success, but there will be barriers as you roll this out. So as you reflect on your efforts in the past, what barriers do you think leaders come across most often when they're trying to create a new culture of well-being?
Oh, that is such a great question. I feel like time is always top of mind, right? We just don't have time. So I think we have to change that conversation, Tammy, that, if we don't take time to create space in a workday for people to prioritize their well-being, whether that's small breaks or extended breaks for teams to do team building things or go to the gym, that's a short-sighted view, because as we encourage people to take breaks and prioritize their well-being during the workday, they're going to be more productive. We're going to have greater retention. We're going to be a better place to work. So time is always a big one. And I would say we don't really have the luxury of not taking time if we want an engaged, happy, healthy workforce. So that's probably one of the biggest ones.
One of the things that you taught me to overcome that time barrier was to really do the things that I was going to do anyway, but in a different way. So instead of sitting down for a conference call, standing up. Instead of sitting across a table, take a walk for a meeting. Instead of ordering bagels for a break, order apples. I mean, all of those things don't take any more time. You're going to do them anyway, and just maybe creating a culture where you do them a little differently. So that was something you taught me. Thank you very much. I appreciate that. I still keep trying. What mistakes have you seen organizations make that have said they've got a commitment to well-being?
It's really important to align what you say with the structure of the organization. So if you have policies and benefits that aren't in alignment with your talk about your commitment to well-being, your team members, your employees will feel that gap, so that your message around well-being feels inauthentic and is not trustworthy. And Tammy, something that you have taught me, so many things, but one of the things that you've taught me is really what it means to be a leader. And to be a leader, you need to be able to say to someone, follow me, and they follow you. And that is about a relationship of trust. So when we have those gaps between our policies, our benefits, our pay, this is kind of getting into the nitty gritty, right? But when we have those gaps, but we're saying we want people to prioritize their well-being, that message rings hollow if there's not alignment there.
So there are many benefits to a culture of well-being. Can you just outline what you think some of the top ones are for those who are considering launching a new program?
Well, I would take us back to the Gallup research, because the Gallup research is extremely clear that when you have a culture of well-being and when employees are thriving in those elements of well-being, you have higher engagement, less turnover, fewer workers' comp claims. You become one of the best places to work. So you become a really desired employer. There's some other research by the Health Enhancement Research Organization around business performance. When there is a robust culture, not just a few things that we're doing, but a robust culture of well-being, it also impacts the business performance. So there is a business case, Tammy, for prioritizing well-being, absolutely.
You reference these not being normal times, and indeed they are not. So maybe we can talk about the last year and a half and the toll it has taken, the toll COVID has taken on the well-being of organizations. What have you seen in your work over the last year? What price have we paid?
Well, it has been a year and a half of trauma. I do believe that is the right word. We knew that we had a resilience problem going into the pandemic, where 1 in 3 nurses were saying they thought they might leave the profession or were experiencing some symptoms of burnout, and almost 1 in 2 physicians. So that's how we went into this pandemic. So I think, Tammy, it's really highlighted several things. Number one, physical well-being is important. We know that. And people that have prioritized their physical well-being in some cases have fared better if they have contracted COVID. But the other thing that I think is highlighted for employers more than ever is the value of social well-being and community well-being, and how huge those drivers are to overall well-being. Isolation, loneliness, depression, all of these things have really come to the surface. And in a way, I'm grateful for that it's brought that conversation out into the open as being really important. So I think that is that's something that we've experienced, throughout the pandemic, is that a renewed focus and understanding that these other pieces are really, really important as well.
I've been doing some reading about burnout, and it's not a turn of phrase that I ever really was very happy with. Nobody wants to be called burned out, I don't think. But in reality, this pandemic has really intensified that issue so very much. You shared some statistics that are pretty important. And burnout is evidenced by someone who's exhausted and cynical and feels ineffective in their work. And it's usually a disconnect between the person and their employer, the person and their leader. And they feel a mismatch in one of several categories: values, workload, rewards. But one of them is social connection. And some of what we have lost during COVID is that social connection. The break rooms don't convene in the same way. People have a mask or a barrier between themselves and the person that they're talking to. And social connection or connectedness is one of Gallup's well-being indicators. There's just so much that has been damaged in terms of well-being, and certainly our commitment to it going forward. Is it ever too late for an organization to step up their efforts with well-being?
No, it's never too late. And I would encourage any employer right now that now is the time to step into it. Don't wait. I think probably some of us are feeling paralyzed, right? I'm grateful to be in an organization right now that is very forward thinking and leaning in to initiatives right now around well-being. So it's not too late. And I would encourage any leader listening. So even if your organization is not there, you still have the ability to lead out as a leader and to be an inspired adopter with your teams. So you start it. You start the movement. You start the prioritizing your own well-being, leading that way, and having those conversations with your team members. And just remember that holistic view. It isn't only, did you run this morning, right? Or again, broccoli. But how are you doing in your family relationships? Do you need to take some extra time to go pick up your kids? If you're working from home, can I give you more flexibility, right? So that you can prioritize that juggle that you're doing at home. So it's never too late. And it really starts with each one of us leading that effort in our organization.
Melanie, if the impossible were possible, what would you like to see in the world of wellness and well-being?
Oh my goodness, if the impossible were possible, I would love it if every organization's leadership and every manager understood the business case and the culture case for well-being and helped and supported every single one of their team members to prioritize their well-being. I think that if we did that, it would radically impact organizations across the country. And I think because we spend so much time at work, it's such an opportunity to impact the health of individuals. Again, that ripple effect. Those individuals live in communities. And then we're talking about the health of a nation. So that would be my big wish, would be to really see that commitment play out across all levels of the organization.
It's a beautiful picture, isn't it? Let me try to summarize what I learned just really quickly. I think one, that it really takes a leader who's committed and modeling well-being for an organization to have an authentic culture of well-being. Well-being is more than fitness and nutrition. It's all about social relationships and connection and spiritual well-being and financial well-being. And we have an opportunity to influence all of those things. There is an ROI, both a cultural ROI and a financial ROI for an organization that commits itself to creating this culture of well-being. But the individual ROI is immediate. The day that we begin is the day that we begin to feel the results. And the impact of COVID has been real. We cannot underestimate what it has done to our cultures, and our employees need our support more than ever to get through to the other side. And then the last I would say is probably this idea of epic small changes, right? You don't have to take on the world right away. You can make little changes that can have a big impact on you and on your department, on the organization, and ultimately the nation. So you're doing it, not in small ways, but in big ways. And I'm very grateful, Melanie, for everything that you've taught me and for the passion that you bring to this really important pillar of leadership work. Thank you. Be well.
Thank you, Tammy.